Hey everyone, and welcome to today's edition of the UCLA Ziman Center for Real Estate's Housing, Neighborhood, and Health series. Thanks for being here today to share this time with us. My name is Christina Green. I'm the Program Director of the Housing as Healthcare Initiative here at the Ziman Center. Before we begin, I'd like to thank our collaborators at the UCLA Center for Health Policy Research, Sean Tan and Tiffany Lopez, for their wonderful partnership in putting today's webinar together. Also, one housekeeping note, we will have time to take questions from our audience following the presentation. So please post any questions you have in the Q&A box at the bottom of your screen. You'll also have the opportunity to upvote other people's questions by clicking on the thumbs up icon. So the Ziman Center launched our Housing as Healthcare initiative in 2018 in an effort to raise awareness about the various challenges and opportunities that lie at the intersection of housing and healthcare. Civic engagement and public service are fundamental to our mission as a public university, and service in the form of educational programming is key to carrying out this mission. So today's Housing, Neighborhood, and Health series presentation focuses on how housing issues affect Californians' access to health and healthcare. Issues of housing in California have been and are critical to current local and statewide political debates, but they are also important to public health. We've heard it said several times before, where you live has consequential effects on your overall being. So in today's talk, Sean Tan, who you see here, will discuss the latest findings from the 2021 California Health Interview Survey, or CHIS for short, that examines that exact relationship within the context of the COVID-19 pandemic, where he found that 1/3 of those with housing affordability issues delayed needed medical care. Sean will walk us through what this means in terms of access to health insurance, nutritious food, safe neighborhoods, etc., as well as how this manifests across multiple dimensions. Sean Tan is a senior public administration analyst and CHIS researcher at the UCLA Center for Health Policy Research. Sean's research focuses on health insurance and access to care, as well as examining issues and interventions surrounding population health equity. He collaborates with CHIS funders and researchers in designing and implementing policy evaluation studies. Prior to working at UCLA, Sean was at the Housing Opportunity and Place Lab at UC Merced, focusing on social determinants of health research, housing in particular, as well as public health initiatives in California's Central Valley. He previously served as a policy fellow for the mayor's office in the city of LA, advancing the Department of Recreation and Parks' gender equity goals and establishing public-private partnerships to increase park and open space access to communities across LA. His policy upbringing stems from years of experience working on policy issues related to healthcare, immigration, and homelessness. Sean received his master's in public policy from the UCLA Luskin School of Public Affairs and his bachelor's in development studies from up north at UC Berkeley. We are delighted to have him here today. Sean, welcome, and over to you.
Thank you so much, Christina, and thank you for that introduction. And thank you to the Ziman Center for hosting us on today's webinar. Just give me an opportunity to share my screen. Christina, let me know if that's being viewed properly.
Yep, looks good.
Okay.
Thank you.
Okay. Once again, my name is Sean Tan. I am from the UCLA Center for Health Policy Research and presenting today on the UCLA Housing, Neighborhood, and Health series. Just a little bit of housekeeping. If you want to stay informed and get copies of our slides, you can send an email to healthpolicy@ucla.edu. And also email us to sign up for our listserv for other presentations and research regarding this topic. Today, I'll be presenting on how housing issues affect Californians' health and access to healthcare. Just a little bit about CHIS, or the California Health Interview Survey. So the UCLA Center for Health Policy Research is home to the California Health Interview Survey. CHIS is the nation's largest state health survey. and the most comprehensive source of health information on Californians. It provides a range of health topics from health status, mental health, health behaviors, access to and use of healthcare, health insurance, and other respondent characteristics. CHIS is a collaborative project funded by federal and state health agencies, California and national foundations, and other funding sources. Just a little bit about the CHIS survey. CHIS interviews adults, teens, and children. As you can see here in this diagram, we have we interview children by proxy of parents. We sample an adult in the household and ask for the parents' permission for any of the adolescents or teens in the household to be surveyed. CHIS is conducted in multiple languages such as English, Spanish, Chinese, both in Cantonese and Mandarin, Korean, Vietnamese, and Tagalog. For our data collection, we use a push-to-web approach using address-based sampling, in which we do mailings and encourage our respondents to fill out the California Health Interview Survey online or through the phone. We also do a telephone non-response follow-up for those who did not respond to our mailings or to our attempts of mailings. In 2021, here's some of our results in terms of data collection and our sample size. As you can see, our total sample size is about 24,000 individuals in California and broken down to different race and ethnic categories. For more information about today's presentation, please visit our website and read our policy brief on this topic, which is now available. Estimates provided in the policy brief and this presentation do not include responses from correctional facilities, dormitories, skilled nursing facilities, or people experiencing homelessness. I would like to acknowledge our funder. This project was supported by the California Civil Rights Department. The contents of this policy brief and this presentation are solely the responsibility of the author and does not represent the official findings or views of the California Civil Rights Department. The main approach that we have here is that housing is a social determinant of health, which means that someone's housing situation has consequential effects on their overall health and well-being. We utilize a framework in this policy brief and in this presentation in which housing affects a person's health through 4 pathways, and those are affordability, stability, quality, and safety in neighborhood. In this brief, we focus on 2 pathways, affordability and stability. There are different ways affordability and stability are defined. In the California Health Interview Survey, adult respondents were asked whether they had difficulty paying for rent or mortgage due to the COVID-19 outbreak. We use this question to define affordability during the COVID-19 pandemic. Respondents were also asked how stable they felt their housing situation were. The responses ranged from very unstable, somewhat unstable, fairly unstable, somewhat stable, and very stable. We combined very and somewhat unstable responses to determine respondents who reported having unstable housing. So let's talk about Californians during the ongoing COVID-19 pandemic. So we examine issues of housing by home ownership status, income, race or ethnicity, sexual orientation, and gender identity, and immigration status. Home ownership is between those who own, rent, or had other living arrangements. Income is defined as a percentage range of the federal poverty level, or FPL. Racial or ethnic categories included white, Black, or African American, Latino, Asian, Native Hawaiian, and Pacific Islander, American Indian or Alaska Native, and respondents who identified as associated with 2 or more racial categories. For our sexual orientation, We compared lesbian, gay, or bisexual identifying respondents with heterosexual or straight identifying adults. For gender identity, we compared cisgender, meaning that their sex assigned at birth is the same as their current gender, and respondents who identified as transgender or gender nonconforming. For immigration status, we compared US citizens with naturalized citizens and non-citizens, which we define as immigrants. In 2021, we saw that 57.9% of our respondents responded as being homeowners, 36.8% said they were renters, and 5.3% responded as having other living arrangement. The total percentage represents approximately 28.3 million adults in California. We found that adults were more likely to report renting are those who live below the federal poverty level. So that's between 0 to 99% FPL, Black, Native Hawaiian, and Pacific Islander and Latino adults, lesbian, gay, or bisexual adults, transgender or gender nonconforming, and non-citizens. When we're looking at housing affordability issues during the COVID-19 pandemic, we saw that 1 in 10, or approximately 3.1 million adults in California, reported having difficulties paying their rent or mortgage because of the COVID-19 outbreak. 12.6% of these adults, or 977,000 of adults who had housing affordability issues, lived in the Los Angeles County region. Comparing some demographics, we see that renters were 3 times more likely to struggle to afford housing than homeowners. That's 18.6% versus 5%. Latino and Black or African American adults were twice as likely to struggle than white adults. That's 14% versus 6.7%. We also saw that lesbian, gay, and bisexual adults, 14.7% of respondents reported having struggled to pay for housing compared to 9.8% of heterosexual or straight adults. 21.6% of, sorry, that is the typo. That's supposed to be transgender adults only. Transgender adults versus 10.2% of cisgender adults struggled to pay for housing. 18.8% of non-citizens struggled to pay for housing during the COVID-19 pandemic. That is almost twice as large as US citizen adults. Moving on to housing instability, we found that 4.4%, or about 1.4 million adults, reported that their current housing situation felt unstable in 2021. Among renters and homeowners, we see that 8.2% of renters reported having unstable housing compared to 1.7% of homeowners. 6% of Latino adults also had unstable housing compared to 3.7% of white adults. Adults living below 200% FPL, 9.2% of these respondents reported having unstable housing during the COVID-19 pandemic. 2.7% of those versus 2.7% of those living at 200% and above FPL. Among non-citizens and US citizen adults, we find that 7.5% of non-citizens reported having unstable housing compared to 4.3% of US citizen adults. In relation to health and access to healthcare, we find that Californians who were facing housing issues, 4.7% reported cutting back on seeking healthcare because they were struggling to pay for housing. So that's about 1.4 million adults. 10% cut back on healthy and nutritious food, and 2.8% just over 800,000 moved to a neighborhood that they perceived to be less safe. We also found that adults experiencing housing issues also did not have health insurance during the time of the survey. Twice as many adults who struggled to pay for housing did not have health insurance compared to those who did not struggle to pay for housing. So that's 15.5% versus 6.8%. Similarly, twice as many adults who had unstable housing did not have health insurance compared with their counterparts, and that's 16.7% versus 7.2%. We also found that adults experiencing housing issues were more likely not to have a usual source of care. 21.1% of adults who struggled to pay for housing also did not have a usual source of care compared with their counterparts, which is 13.4%. 27.1% of adults who had unstable housing also did not have a usual source of care compared with their counterparts. Adults experiencing housing issues are more likely to delay needed medical care. We found that 1 in 3 or 33.6% of adults who struggled to pay for housing compared to 1.5%, 1 in 5 or 19.5% of adults who did not struggle to pay for housing reported delaying needed medical care. Similarly, 1 in 3 adults who had unstable housing also delayed needed medical care compared to 1 in 5 of adults who reported having stable housing. So what are the implications of these findings? One is that these findings show that housing is a social determinant of health. Millions of Californians are struggling with housing affordability or live in unstable housing situations and face barriers to accessing care. Addressing issues of housing must be approached with an equitable lens, as Californians from various communities already made vulnerable by systems of inequity and the COVID-19 pandemic are disproportionately struggling with housing issues and access to care. I wanted to point out some of the features of the California Health Interview Survey. So this is using our AskCHIS platform, which is our publicly available platform in which you can also use the data that we have presented here to also make your own findings and research regarding housing and access to care. So I just wanted to show that within the UCLA Center for Health Policy Research, we are making data as publicly available as possible. We also have a variety of different ways you can access CHIS data. Besides AskCHIS, you can also use our AskCHIS Neighborhood Edition, which provides mapping capabilities in which you can look into certain neighborhoods in terms of different health topics and health disparities, and as well as using our public use files as well as our confidential data files. Thank you so much for your time, and I'm looking forward to any questions.
Thank you so much, Sean, for that presentation and pointing out the strong connection between housing affordability, housing stability, and healthcare access, and really highlighting the importance of addressing housing issues as a public health concerns and having to approach those solutions with an equitable lens. I'd like to welcome Tim Kawahara to our forum here, who is the Executive Director of the UCLA Ziman Center for Real Estate, who will moderate the Q&A segment and a discussion. Tim, thank you for joining us.
Thanks, Christina, and thanks, Sean, for that presentation. That was really great, and I hope we can have a good Q&A session here and just a moderated conversation about what your findings were in your research. I'll probably ask a few questions that maybe weren't specifically addressed in your presentation and your research, but would be happy to curious to hear your thoughts and your viewpoints on some of these things as well. But I thought what I'd start with is just your definition. You mentioned that there was some stratification in what you define as unstable housing. in being in the real estate space, we look at that as everything from, homelessness to being one paycheck away from not being able to pay your rent, or maybe under, starting eviction proceedings, all the way to just couch surfing, not having a permanent place. But, in terms of the stratification of how you define unstable housing.
Yeah, that's a great question. And, we leave it up to our respondents in terms of how they somewhat, define what is unstable for them. But in our public health research, instability can go from anywhere from what you already mentioned, such as, part of it is affordability, but it's also, frequent moving around, whether, if you're a renter and struggling with your rent and you have to move to a cheaper place. We saw that connection with one of our healthcare trade-offs where people are moving to less safe neighborhoods. So that could also be a neighborhood condition factor where people are feeling that their housing, whether they're both struggling with affordability, but also the perception of how safe they are in their neighborhoods, as well as just in terms of the overall feeling and makeup of what their current housing situation looks like.
Yeah, and so I suppose that would include then both renters, but potentially homeowners as well.
Homeowners as well, yes.
Yeah, a lot of people are facing foreclosures and things like that as a result of the pandemic. So, okay, good to know. Christina, do you have a question from the Q&A chat that you'd like to bring up?
Yeah, it relates to something I wanted to ask also. Carlos Aguilar asks, will there be another round of surveys? He would like to see more info on renters, since the majority in the city of LA and most burdened by economic challenges. Yeah, I was curious, like how often will this, run this data? Because it'll be interesting to see, 2023, so the point in time now, what that looks like. And also related to my other question, has this same sort of set of data been run before in the past? And how have you seen the change if that has been done before?
Yeah, that's a great question. So we actually had fielded the 2022 questions with our housing module. So the same set of questions are in our 2022 CHIS, which is set to be released in October of this year. And I believe the same module will be sent in 2023. And I think in our CHIS as an annual survey always looks to our, our respondents, our funders, our interested users in terms of different ways they want to see questions asked to California. And so we always welcome different ways people want to look at issues of housing. And we do know in the near future, I believe in 2023, we'll be fielding some of housing discrimination questions as well, specifically related to particularly with a focus on Asian Americans, especially during a time of hate incidents. So we're looking into these factors in which Californians are affected by both the housing issues, discrimination, as well as what this could look like in terms of their health outcomes.
And so do we at the Ziman Center, we can keep everyone posted, maybe perhaps when those next briefs come out, because it will be interesting to see how this relationship progresses through time. Was it just, isolated with the COVID-19 pandemic, or is it actually, is it going to continue, especially as housing stability and affordability continues to be a huge issue?
Yeah, and that's definitely something that we're continually monitoring as well, just in terms of what are the impacts of the COVID-19 pandemic. But as we've written in the policy brief, Californians have experienced housing issues way before the COVID-19 pandemic started. And so crucially, one of the main points of the policy brief is to urge our decision makers and policymakers to really think about housing as part of public health, and to think about what are ways that we can improve housing situations in a way that is not siloed.
Yeah, another question that This may be, again, beyond the scope of your research here, but curious about, there was several government efforts of intervention to mitigate the impact of the pandemic. And in particular, I'm thinking about eviction moratoria and trying to keep people stable at least through the course of the pandemic. Of course, those moratoria are now beginning to end and lift. But any thoughts on the efficacy of eviction moratoria at both the federal, state, and local levels in terms of keeping people housed and what positive health implications that may have?
Yeah, so we didn't ask our respondents regarding if they had eviction protections, but research does show that these recent evictions moratoria, especially during the COVID-19 pandemic, kept a lot of people from losing their homes. And so another factor that we didn't discuss in this policy brief but is still very relevant, is homelessness. And so part of it is in public health. We try to make sure that we are working upstream and with an upstream approach. And so keeping people housed is number one priority. And part of it is also not just protections, but also making housing affordable in California, given that both homeowners and renters face similar issues of affordability. But renters disproportionately are experiencing the housing affordability issues in California.
Yeah, it's an ongoing problem that will surpass certainly the tamping down of the pandemic. I mean, as we all mentioned, affordability and evictions, and it's been an issue well before the pandemic, and unfortunately looks like will continue to be a problem going forward. But in terms of the health, did you look at mental health at all? I mean, obviously living in a very unstable housing environment and worrying about whether you're going to have a roof over your head, whether there was any consideration about mental health outcomes in addition to traditional physical health.
Yeah, absolutely. Part of defining health is part of that is mental health. And we do have a question. We asked respondents about how much they worry about housing affordability issues, especially during the COVID-19 pandemic. And our findings show that people who did worry about housing affordability issues were more likely to exhibit either moderate or serious psychological distress. We have a page limit in our policy brief, but it would be also a nice kind of publication that we'll be continuing to produce in the future. We're actually looking at these topics, whether that's housing and access to care, housing and mental health and access to care, in our manuscript publications.
And I would guess that as well, living in unstable housing conditions would impact, related to health, educational attainment of the children that are living in those environments as well.
Yeah, and that's certainly a point that we're interested in looking more into, just because there are different ways the COVID-19 pandemic has affected housing issues, but also the health outcomes of all Californians.
Yeah. Christina, why don't we take a question from the audience?
Absolutely. And I apologize if you've covered this already, but as far as the other living arrangement option in the survey, did that drill down into what falls into other? Is it those experiencing homelessness, those who've doubled up housing, et cetera?
Yeah, so our survey does not survey people experiencing homelessness, but it definitely is individuals who may be in a situation where they're not renting or are homeowners. So that's somewhat our other category, and that could range from different responses. Unfortunately, I don't know what the top response is, just because in terms of our data protection, we want to make sure that we're not disclosing anything that can be identifiable. But
Sure.
I would be interested in looking that further in terms of if people are interested in that.
For sure. And Jean asked, did you explore why those who didn't have health insurance didn't have it? I guess pointing out that especially now that one doesn't need citizenship status to obtain Medi-Cal.
Yeah, I guess that's a two-part question. And so I would answer the first part. So we did on our survey, we do ask, what are the top reasons people are uninsured? And I think a majority of our respondents said it was cost associated with health insurance. So we can see that both housing affordability and the rising cost of healthcare affect both the way people are able to afford housing, but also are able to afford healthcare. And we do know now in California that we made strides in making sure that immigrants, particularly undocumented immigrants, are able to access Medi-Cal, but we're still waiting for ages, I think 27 to 49 to be able to access Medi-Cal. But there are different ways also on how and why Californians are not able to be insured, but one of them is particularly in terms of their ability to pay for housing.
Great. I guess there's also this issue of you're discussing people bypassing healthcare, but there's the impact of COVID itself. And we know, for example, that that living in crowded situations, places where we have immense density and people living multiple generations, or families of 8 living in 1 2-bedroom apartment, that there was more COVID spread in that environment. And obviously that's a direct correlation between poor and unstable housing and the actual spread of COVID and how COVID impacted those families. Any thoughts there?
Yeah, that's actually one of the things that I would have wanted in our survey as well, as just looking at multi-generation households and how they fared with the COVID-19 pandemic. And you're exactly right. A lot of our multi-generation households were disproportionately impacted by the COVID-19 pandemic. And I believe, part of that can also be attributed, or our respondents attributed, to housing instability, as a crowded situation at home, making them feel more unstable, especially during the COVID-19 pandemic.
Yeah, Christina, a question from the audience?
Yes, Leah wanted to ask what government programs besides the COVID rent relief program were available to help aid in the housing issue in our state?
I believe most of it are from stemming from the COVID-19 relief programs, but individual counties and local governments, especially in the city of LA, had their own kind of protections as well. Particularly in the city of LA, they created eviction moratoriums that would have lasted longer than the state moratorium. And so, ways in which renters are protected varied across different counties and regions in California.
I've got one more question here from our audience. Low access to homelessness and low access to healthcare, that relationship seems obvious, and many data obviously support that connection. Do you or just have data to show how stable home condition improved healthcare access and outcomes, sort of the converse?
That's a very interesting question, a great question, actually. And so I think that's something that we will look into further. Actually, I'm going to write that down. That's actually a very good research question, just to see how housing stability actually improves healthcare access. But yeah, that's definitely something that we'll be exploring, especially in our journal manuscripts.
Oh, for sure. And I wanted to ask if you could talk a little bit more about perhaps people in our audience are researchers themselves or students, want to access the CHIS survey. Is that easy to do? I know you shared the website earlier. Do you have to be a member? I'm not quite. Could you just explain a little bit how that works?
Yeah. I just alluded to it in my presentation, but the best way to access our data is using our Ask CHIS platform. So it's a website in which you can create a free login account. And basically, it provides a lot of the questions, estimates that we've already quantified for users to easily look at both, issues of housing, but as well as issues of access to care or just healthcare in general. And there's a lot of different ways that you can look into housing situations. Our survey was founded since 2001. And so a lot of our data goes back to 2001 with, varying availability of the questions, but a lot of our healthcare, insurance and access to care questions are trendable back to 2001. So you can really see the progression or regression of how housing or access to care have fared in California. And a lot of them, you can see, different bumps and ebbs that, can point to policies. And so that's one of the reasons why we also provide these policy briefs and presentations is, to really urge action towards these issues that we're seeing, especially issues of disparity and inequity.
Yeah, and actually that relates to Carlos's earlier question. How is the Center for Health Policy Research sharing this info with elected officials? Besides, doing presentations like this, are there any special briefings that, elected officials get from UCLA?
Yeah, and so, one of them is this webinar and our presentations, our policy briefs. We work with different organizations across the state who have supported and funded things like our policy briefs to make sure that policymakers and lawmakers have something in hand in terms of, the latest estimates in what Californians are experiencing in a range of different settings. But we also have another department in the at the center that actually does bill analysis as well for our legislative body. And that can also be another way that policymakers are able to get data and make data-informed decisions about the future of California.
Great, thank you. Tim, a question for you actually from Lois. Have developers changed their practices in relation to health issues and the COVID-19? We know that developers are affected by fiscal financing and regulatory land use issues, but curious about what you've been hearing, if anything, about sort of COVID, health and housing and development.
Yeah, my good friend Lois Takahashi. I haven't seen developers change the way they operate, really. I mean, fortunately for developers and builders, they were deemed an essential business during the COVID downturn, so they continue to operate. I know that on construction sites, there was a lot of public health inspectors that needed to see how you were operating your business and making sure that it was safe and social distancing and all that sort of stuff. So there was some change in public health related to the actual construction process, which I understand slowed things a little bit down. But construction and development continued on. I think that in general, going forward, you're going to see buildings. You're going to want the general public and the tenants of these buildings are now going to want more open space, more open windows. HVAC issues are probably going to be looked at more carefully. I know that's happening at least on the commercial real estate side. Probably would go into the residential side as well. Like how many times does the air turn in your building? And so I think there are some actual hard construction and design elements that are being incorporated into building. As Lois knows, the land use issues and the regulatory environment in California is already incredibly difficult to build here. So, just adding one more obstacle, but I haven't seen any specific change in the way developers are building or operating.
Thanks,
I don't know if that answers Lois's questions.
I think so, yeah.
Another question to you, I guess, Sean, I don't know if you looked at the correlation between, you're talking about healthcare access. A lot of times it's housing, but it's also tied to transportation. And so whether that was any consideration, whether folks, the ability to use public transportation or, not having a car, or how the correlation between housing and transportation may tie in all this as well.
Yeah, I think that goes well beyond my my current research, but that's definitely something that is, I would presume, have a factor or an impact healthcare access. I do believe we have some questions on transportation on CHIS, but a majority of our questions are focused on the housing module.
Yeah. And are your respondents, or the folks that you're surveying, are they mostly urban, or are you looking at rural audiences as well?
Yeah, so we try to make sure that it's representative of California's population. And so we do have both urban and rural. When I was showing our survey data collection, we try to make sure that through some of our like predictive modeling, that we're able to target households of different characteristics, whether that's, based on their race and ethnicity, age, gender, geographic location. And of course, we do survey in all counties in California, with some being created as straight as, but basically the California Health Interview Survey makes sure that, it is population representative, and it reflects the perspectives and experiences of Californians.
And then also like age diversity. I mean, how do you ensure that the folks you're surveying are representative from a age spectrum?
Yeah, so like I mentioned during my presentation, we survey adults, teens, and children. And so we make sure that through this way that we're able to capture pretty much most age groups that people are interested in researching, and are people in California, basically.
Yeah, Christina's actually working on a program for housing-based healthcare for seniors. Maybe Christina, you can mention a little bit about that briefly.
Yeah, sure.
Clearly that could help address some of these health issues during a pandemic.
Absolutely. It's the California Integrated Care at Home program, which is based on support and services at home, housing-based care management model in Vermont. And, sort of just anecdotally, the stories we've heard during the pandemic was how valuable having, a link to a healthcare link actually embedded in the housing, how important that was, especially when, everybody was isolated at home, vaccines needed to be distributed. The advantage of having, care embedded in low-income housing was critical during the time of the pandemic. So yes, we'll be sharing more information about that for sure, because that is a model that we hope to bring to California in the not too distant future with a pilot in LA County. A question to Sean. Did you look at employment types, first responders, essential workers, versus folks who could work from home in terms of housing instability?
Yeah, so we actually have a question in regards to whether a respondent was an essential worker or not. Unfortunately, I didn't look at it in terms of the relationship of those essential workers and housing affordability or instability, but that's definitely something that CHIS users can do on the AskCHIS platform if they're interested. I might just do that also after this presentation, just to see what the estimates look like and whether we see any disparities amongst essential workers in terms of housing affordability.
Yeah, I think, again, with these sort of social justice issues, social inequity issues, important to note that many folks were able to work remotely, right? I mean, a lot of white collar folks could stay at home and stay safe. And disproportionately those that are, had to be at work because they're janitors or factory workers or gardeners or whatever, disproportionately impacted because they didn't have the option of remote work. That's an ongoing problem going forward as well.
Well, what's great is I think really thankful to all of these questions and conversation, because it's providing us great ideas for, what people might want to hear in the future from us. And, really looking forward to working more together with you beyond just this webinar, Sean, because it just seems like there's some aspects in that CHIS survey and our interest with our audience in housing to continue to provide information like this in the future.
Yeah, thank you so much. And thank you for the continued partnership. I know the Ziman Center had helped us out on our E.R. Brown Symposium on homelessness. So
Sure.
that's already been one of our main housing and homelessness have been, our priority. And so we always welcome these collaborations, especially with a fellow, center at UCLA.
Absolutely. Um, I don't know if any more questions are going to come up. Tim, do you have any other questions for Sean? Yeah. Yeah, it's a really great session. Thank you, Lois and Carlos and all our other participants and listeners today. And Sean, again, for sharing your housing and health research. We really appreciate it. And thank you, Tim, for the discussion and helping out with our Q&A. And to Tiffany Lopez, again, at the Center for Health Policy Research, and Julie at the Ziman Center for your help in supporting this program. Last but certainly not least, I also want to thank our Ziman Center's many generous donors, without whom none of our work like this would be possible. So if there aren't any more questions, I think we can call it an afternoon. Thank you, everyone. We'll see you next time, and we'll let you know when the next Housing, Neighborhood, and Health Series presentation will arrive, and we'll make sure to follow up with more information on this particular set of data. Thank you, everyone.